Well, what they're acting on is things that people don't want, like Medicare for all. I mean, it is amazing that we're going into this presidential debate, and Medicare for all is becoming the mantra, the signature, the battle cry, the flag of all of the Democratic Party and all of their candidates. Because what Medicare for all is a single-payer, universal health care system that outlaws private insurance, because that's the only way that it can work. It outlaws that. You cannot buy private insurance. That's illegal. And it is a hostile government bureaucratic takeover of the entire healthcare system and everything that goes with it in the United States. And for the 220 million people right now that live in the country that have private insurance through themselves or through their companies or through their employer or whatever, their church, however they have it, they're gone. You will be forced onto rationing rolls. The government will tell you whether or not you can get rotator cuff surgery. We have a player on our baseball team. His name is Parker Clark, GCA senior. Last week he went to Alabama. He's 15 years old. Right-handed pitcher. Threw his arm out. Long story, it happens. Now, kids throwing earlier. He also plays football, throwing that around. Had to go to Alabama for Tommy John surgery. Now, let me ask you something. Under a socialized national takeover of your healthcare system, have you thought about this? You have a son or a daughter, and they play ball, and they need surgery to repair their arm so they can pitch or play again, like Tommy John surgery. Guess what? That's not available. You can't buy it. It's illegal. And if you try to buy it, you're on that list, and maybe he'll get it when his career is over in 12 years. This is called rationing. I was on an airplane coming back from Florida the other day, and a person with a dual American UK citizenship told me on the plane, chatting a little bit, she had just got back from the United Kingdom, where the government controls the healthcare system, and she was saying that she was satisfied with the whole experience. Great. You're a dual citizen. You'd like to go back to the UK and get your health care, and it doesn't cost you anything. Okay, I get it. We go in a little deeper about the conversation, and she says, well, it's got a lot of problems. I'm like, really? Well, what are some of those? This is a dual citizen. She says, well, I have a brother who tore his rotator cuff, and he went and was diagnosed as he needed his rotator cuff repaired. It was so serious that he can't lift his arm to comb his hair. Now, having pitched in college, I get it. I had arm problems forever until finally I worked it out by working out with small weights, getting cortisone shots. But I went years where I could not lift my right arm over my head without pain. I couldn't comb my hair when I had it. It was hard for me to shave. So I had to take Advil all the time. You blow your arm out, right? So finally got the surgery, went to doctor, orthopedic, all that, got it done. It's so serious, it limits the use of his arm, and he's in pain. So he was diagnosed at it. He had to go on a rotator cuff surgery list. He's been on the list, she said, for 9 years. 9 years. Like 999, right? 9 years. He is still waiting on a list for surgery because it's not viewed by the British government as top priority. Other people with more pressing emergencies keep moving to the top of the list. So he's been waiting for 9 years. What good is it if it's free, if it's not accessible? Because government bureaucrats are controlling his health care. Doesn't matter what his doctor says. They don't have time for him. So he's in pain for 9 years. He would have to go to the United States and pay cash, or Canada or somewhere, to get it done. It's unbelievable. Now, these are true stories. These are cautionary tales for Americans when you look at Medicaid for all, single-payer system, universal health care, and a hostile government takeover of your health care system. Now, am I in favor of MedX, the public option? Sure. I'm not going to buy it. You don't want to buy it? Don't buy it. You want to buy it? Buy it. You have to pay for it. It's cost neutral. If the service is bad, you're not going to continue to pay for it. It'll collapse under its own weight, but you're not going to cancel or get rid of what we have now. Last year, the Guardian newspaper in Britain noted that patients are suffering as a direct result of the UK National Health Service's inability to meet key waiting time targets. If you like waiting in line at the VA until you're dead, you'll love the UK's National Health Service system, run by bureaucrats and politicians, who, by the way, get your vote because they control your access to health care. Just like Maduro in Venezuela, in Caracas, controls who gets what food box on what day. Do you get the red food box, the white food box, or the yellow food box? Maduro controls your ability to eat. They're going to do the same thing here. In March, a study issued by the Royal College of Surgeons in the United Kingdom concluded that state-run hospitals continue to struggle to reduce long waiting lists, which include over 225,000 patients that have been waiting more than 6 months for treatment. You will go on a line. And if some bureaucrat doesn't think you need Tommy John surgery, you won't get it, Parker Clark or anybody else. Your pitching career has just come to an end. Sorry. Or your parents have to have the resources to take you somewhere else, out of the country, to a doctor you don't know. Talk about you don't pick your doctor. You don't even get a doctor. Forget about picking it. This thing is so insane. They also say in the UK, tens of thousands of elderly people are left struggling to see because of an NHS cost-cutting drive that relies on them dying before they get cataract surgery. So the whole system is based on you croaking. That's what Bernie Sanders wants.